Hello my friends, welcome to my YouTube channel. My name is eberechiayogu. You are watching eberechiayogu Health Team, a channel that teaches you about infectious agents and the diseases they cause. So today I want to be talking about a particular virus. The virus that has been in existence since a very long time. So this virus has been causing infection that we all know about, but many of us don't know that it is this virus that causes that particular infection, because we only know that the infection has been in existence, but many of us don't know exactly what is causing it. So before I go to what I want to say today properly, I want to introduce to you what a virus is all about, because many of us don't know what is virus. They will just hear that virus, and many will always think that once they say virus, what you mean is coronavirus. So virus is much more than coronavirus. So what is a virus? Virus is the smallest micros submicroscopic infectious agent that can only replicate in a living cell. When it is in extracellular environment, it is inactive. So this virus is made up of nucleic acid. It can be either RNA or DNA, but it cannot be made up of two of this nucleic acid. So this nucleic acid is one of the things they use in classifying viruses into the families where they belong. So why is virus submicroscopic? Virus is submicroscopic because you cannot view virus in an ordinary light microscope. It must be an electron microscope because of the size of the virus. Virus is the smallest infectious agent, very small. So what is this virus I want to talk about? The virus I want to talk about is called measles virus that causes measles infection. So this virus is from a family of virus called paramyxoviridae, and in every family of virus there is another one called a subgroup called genus. So each virus has like 4 to 5, or how many genus that they are going to have. So in this particular one, we are going to focus on one genus which the measles virus fall into, called viruses. That's the genus in that family of paramyxoviridae. These viruses are single-stranded RNA virus, and they are not segmented, because there are other viruses like that resemble them, but their nucleic acid is segmented. So this virus, how is it being transmitted? The virus is transmitted through respiratory tract by the inhalation of the aerosol, that is the secretion of the mouth and the nose. So this secretion, when this secretion is being released through sneezing or coughing, and the susceptible cell picks up the infection, the person will be down with the infection. The susceptible cell picks up the virus, the person will be down with the infection. So the route of transmission is the nose or the mouth. When this virus passes through the nose, it gets to the pharynx, to nasopharynx. In the nasopharynx, there is a cell that has receptor, because on this virus there is what is called hemagglutinin that is on this virus. That is what is going to attach to the receptor on the cells in the nasopharynx, and it will now fuse into that cell and begin to replicate itself. So what is replication? It begins to make copies of itself and multiply there. It can also multiply at the regional lymph nodes. So when it multiply at the regional lymph node, with time it now enters what is called viremia. It enters into the bloodstream, and it will make, the first one is called primary replication, and it will now replicate again. That is secondary replication, and the symptoms begins to occur. So How do we know the symptoms of this measles virus? Measles virus, measles infection is characterized by the high fever that is greater than 40 degrees centigrade. Another thing that is obvious about it is that measles virus used to come with a flat red rash that is called maculopapular rashes. So when this rash begins, it begins on the face and get down to the trunk and every other part of the body. And this symptom appears from 3 to 12 days after exposure. So when these symptoms appear, there's another symptom called Koplik spot. It is a white patches that you will see on the person's mouth. It is like white patches. It's called Koplik spot. It's another symptom of this virus infection. So these are the when the virus is at its simple form. But this virus can be very dangerous. It can be complicated. When the virus has complication, the symptoms may be pneumonia, it may be seizure or blindness. Though these ones are rare. It can cause inflammation of the eye, which is conjunctivitis. It can cause encephalitis. That is when the measles virus has entered into the central nervous system. It can enter into the brain. So this virus can be very dangerous if care is not taken. It's infection. So this measles infection can be prevented, but this measles can be prevented. Why? Because this measles, once someone has suffered this measles, the person has immunity for life. So the person will not suffer it again. It is one time infection because it confers a long life immunity. So a mother that has suffered this virus passes this immunity, the antibody, to a fetus in the womb. And when the baby is born, the baby will be protected by this mother's anti-immunity until 9 months of age. So at this 9 months of age, the baby is expected to be taken to hospital for immunization, because this measles virus has vaccine. The vaccine is called, it can be single or in combination. It is called it comes in combination, it is called MMR or MMRV. That is the combination of the measles vaccine, the rubella vaccine, the mumps vaccine, and the varicella vaccine. So when the four of them are combined, it is called MMRV. So the person is expected to take this vaccine at 9 months, and also another dose, because it's supposed to be 2 doses, another dose at the 4 years of age, so that the person will be fully protected from this infection. So but if the person was not immunized and the person suffers this infection, the person is also protected from this virus. The person will not suffer the infection again. The measles virus does not have a treatment. You just treat the symptoms, because majority of those symptoms are caused by bacteria, which is called secondary infection. So this measles virus can be managed by because this measles virus has high mortality rate and high morbidity rate. For you to reduce this morbidity and mortality rates, you have to give the person vitamin A, especially in the developing countries. So these are the treatments that is available. But it is better, because they say that prevention is better than cure. It is better that whenever you have a child, have a baby, rest assured that you have given the baby immunization for measles virus. It is everywhere, it is very common. So don't be a victim of this dangerous infectious disease. Thank you for watching my channel. Thank you for subscribing. And if you have not subscribed, please do well to subscribe. By doing so, you are supporting me to grow. Thank you very much.